Alright guys, this is going to be the last review. We're talking about for the HESI management. One of the questions is talking about CABG, post-care, post-op care. Who would you delegate that to? First of all, what is CABG? What is important to monitor with this person? What tasks can be delegated? What are some things that may have precipitated the CABG that you're probably going to have to talk about, teach, and discuss and educate your patient? What care would be expected? What medications would you expect to be given for this patient? What orders, labs would be drawn? What kind of diet would they be on? And what would be the care when this person goes home would be some things that you would need to address and look at. Another question we have, leadership RN actions to UAP that would report, we would want to report them to report to us abnormal vital signs. We would want to report also to the UAP to obviously be watching for if they go in the room and the patient states that they're having pain or they don't feel right or something like that, that they need to get back to the RN so that the RN can take care of the issue. Abnormal behavior of patients up and about, skin assessment, AM care, diet, I's and O's, daily weights would all be some things that we would need to pay attention to and report. From that, we're going to move into, we've did the community care, we've done fundamentals, we've done critical care. So we're going to start with some of the professional issues. Leadership, orient refresher. I'm not really sure what that means, but I would think orient refresher, that could be an orient refresher for a nurse who hasn't been on that particular floor for a while. It could also be that we orient our patients in how we do that, regardless of what their diagnosis is, if they've come to a different facility, if they've came to a different floor within the facility. There are some different things that we pay attention to, or some different protocols and rules that need to be abided by. Also, it talks about leadership, legal and ethical stuff, assertive management. Assertive management would be probably most likely that we take care of things. To be assertive, you're going to assert your authority and you're going to make sure that things get done, however that may be. We already had a discussion about management and the different types of leadership, so you probably need to go back and address that if you can't remember. Diabetes, mellitus, diabetes, what types of things can be delegated? It doesn't specifically say delegated to who, so again, you're going to remember the scope of practice and the things that can be delegated and who can they be delegated to. And again, remember the scope of practice and what your board states that that person can do and what your facility states that that person can do. Skill evaluation, how do we evaluate skills? How do we write on a care plan that we're going to evaluate skills? We obviously need proof. You're going to want them to either read it back to you or demonstrate back. We don't always like verbalized because lots of people will say they understand things even when they don't. If it's something that can be read back or taught back or things like that, or demonstrated, that gives you a better understanding that that patient understands what's going on. A professional issue, it says about a visitor on the bed. Beds are for patients, and it depends on the situation, obviously. But for most facilities, they would state in your NCLEX book, and probably most of your books would state that that is not appropriate, and we would need to ask them to please remove themselves from the bed. The bed is for the patient. Also, we want to talk about change. How do we implement change? Change is something that's hard for everybody, and how do we go about implementing change? Sometimes we have rules and regulations and protocols, and we have to change things. We don't get a choice. But there are other times when we do possibly make a change depending on something that we have seen, something that we have had happen to us and it worked. We need some research. You need evidence-based research to back you up, and then you maybe can start implementing a change. Continuity of care and report. Continuity of care is talking about that you are taking care of this person and you take care of this person day in and day out. It's really hard to do that in a hospital setting because we don't all work the same shifts, we don't all work the same hours. So you want to provide as much continuity of care as possible. In a nursing home setting, it's easier to do that. Even in a hospital, if they have to go to physical therapy or OT or something like that, some of that is easier for the patient because they're seeing the same people. So just remember, continuity of care. We want things to be smooth. You want the transition to work well. Report transfer. If you've got a transfer that you're reporting, what would be some things that you would need to make sure that that person knows about this patient? Depending on if they're coming into your facility and they're just transferring from one floor to another, but what precipitated them coming into the hospital? What type of care have they received since then? Have there been abnormal things? Has there been surgery? Has there been, now there's a dressing that there wasn't when they first came in. We have several IVs. We need to talk about those. We need to talk about what fluids is running, or are they getting antibiotics? If so, if they have a peak and trough, when would that be due? Are they diabetic? Are they receiving insulin? Are they only medication controlled and diet controlled? With that, then you'd have to talk about diet. So think about the things that you would need to report. Also think about things like if you were the one receiving the patient, what would you want the nurse to tell you? Management policy. What's your policy on management? Usually we go through the chain of command. There are different policies, and where would they be located? Are they truly followed? If they aren't followed, why aren't they being followed? And things like that. Litigation prevention. Again, what is litigation? And what things would we employ that would prevent litigation from happening? If you don't remember what litigation is, you need to look it up. And then go think about, how would I go about as a nurse in a facility to prevent this from happening? HIV standard precautions. We've talked about standard precautions a lot. We've talked about hepatitis. We've talked about Ebola. We've talked about a lot of different things. But standard precautions are to be used on everyone, regardless of race, regardless of age, regardless of diagnosis. And remember, HIPAA plays a big role into this too. But HIV standard precautions, you need to watch for your needles. Again, I think we've talked about try to use a needleless system if at all possible. Surgical unit priorities, it's talking about leadership and professional issues. Surgical unit priorities. If you have a patient who has just came back from surgery, that patient's going to be at the top of the list versus a patient that's 3 days post-op. Think about your priority list. Think about your ABCs. Think about pain. Think about, what are some things that I can fix right at this moment? And then think about, your priorities and what do I need to do? Who is the priority out of these patients? They like to give you 4 patients and tell you or say to you, which one is a priority. Basic nursing skills, transmission precautions. Again, you need to look, I think I've already told you in the NCLEX book what pages, about transmission precautions. That would be contact, respiratory, droplet, and standard precautions obviously is in there. What would be some things that we would implement to make sure that those precautions are in place and that they will be followed to protect the patient and to protect the staff? Leadership diabetes assignment, again, know who can be delegated to, and again, know their scope. If you've noticed, the trend is delegation with this HUSI, priority with this HUSI, because that talks about leadership, management, and critical thinking, nursing judgment. Documentation, delegation of heat. You know, there are some instances where heat is good for a patient. In some instances, it's good for a patient to not have a bunch of heat, to have cool. I'm thinking that's probably what it's talking about. And remember, if you delegate a task, you still need to chart, you still need to follow up on it. You are the nurse. Living will, no heroic measures and documentation. You know, how would I document that? If the patient is a DNR, simply state patient is a DNR. DNR doesn't mean that you don't have some comfort measures. DNR means that there's no heroic measures, such as, you know, you're not going to put a PICC line in this person. But we do try to keep them as comfortable as possible, so think about those types of things. Missed prescription. What would happen if we missed a prescription? If it was transcribed incorrectly, or if it was just missed entirely, you know, someone is responsible for that. They would probably have to do a root analysis and look back at it and see where the omission occurred. You know, where did this breach happen at? Who kind of was responsible for it? And figure that out. Mental health professional issues, anxiety, arguing nurses. That would be something that your manager, if you have a management position and you have two nurses that are arguing, you know, please pay attention to what your book states, but right off the bat, I think that you remove them from wherever they're located, take them to a private room. You may not want to be in there by yourself because it's they said. You may want to take another witness depending on what the issue is about, and you would want to document your actions, and you would want to also you know, have a good note record of what happened, what was the plan of action that occurred, and then what was your outcomes about that. Organ donation. CORE is the big organ donation thing that we work with. With that, excuse me, when you have a patient who is an organ donor, there are certain things and certain steps that you have to take. You have to call CORE. You have to report that there has been a death. This person isn't possibly whether they are, you have to report to death anyway. And if they're an organ donor, then of course they're going to ask a lot more questions. There are certain things that would warrant that this patient would not be a good donor, but you're not to make that decision. They will make that decision. And then, you know, we also have to abide by what they want. If they come in harvest organs, lots of times there are different rules for that. The body has to be kept cool till they get there, and depending on if it's a heart or something like that that they're going to harvest, we would want to try to keep the patient alive, you know, at least the heart beating till they came and would be able to do that. Some things the patient doesn't have to be alive in order for them to harvest certain things. You know, they can harvest the bones, they can harvest skin, they can harvest the eyes, they can harvest a lot of different things without, but you just need to know what your protocol is for that. Next, we're going to talk about geriatrics, leadership, Cushing syndrome. What's Cushing syndrome? Again, if you don't know what Cushing syndrome is, you probably need to go back and look it up. There are certain things that point to Cushing's as a diagnosis. As a nurse, we're not allowed to make that diagnosis. That's a medical diagnosis. But there are certain things and certain interventions that you would need to do to take care of this patient. So think about that and professional issues. What would you do? Management, contact dermatitis. What is contact dermatitis? Contact dermatitis is when you come into contact with something and your skin doesn't like it. What is it going to look like? What would be some things that you would think that we would expect to have ordered for this patient, as far as medications, as far as would we want heat, would we want something cool applied, would we want a topical medication, would we want an ointment applied, would they want something for pain, would they want something for itching? You know, go back and look at for dermatitis, contact dermatitis, and think about what things that may be used for this patient. Also think about, what did they come in contact with that gave them contact dermatitis? You know, we want to make sure that if they know what it was, stay away from it at all possible. There are things that you can use over the counter, but there are prescription things. And if they're bad enough to come to the doctor, lots of times they need something prescription. Not always, but most of the time. Leadership, paresthesia, assess first. What would you assess? ABCs, guys. Pediatrics, decision making, take initiative. You know, with peds, it's very different sometimes in what you do. Your medications are not going to sometimes be given, you know, you need to, a lot of the medications are weight based, and it's not pounds, it's kilograms. Remember how you, what's the magic number for that, for pounds to kilograms. And there's usually a formula that you need to figure up and figure, you know, what would be a safe dose for this pediatric patient, what would I expect to be given, and how often would I give it, things like that. So you need to think about that, especially with kids. Sometimes kids too, you know, things happen quickly with kids. They can be okay one minute and not the next. So you need to be assessing and monitoring and always on your guard with them. Professional leadership, delegation, dressing changes. Again, you need to think about, what kind of dressing is it? Is it something that needs to be sterile? Is it something that's just a dry dressing that needs to be done? And even with that, you'd want to document certain things. So you would want to make sure, again, that this is within that person's scope. Delegating authority. You know, who can I delegate authority to? Employee support. We need to be supportive of each other. We're a team. I don't know what else to say about that other than, you know, if you see someone is drowning in their work, you know, and you're caught up, I would expect you to go help them. I would think that would be the only thing that you could do, and it would be the nice thing to do, and you would want somebody to do it for you, so why wouldn't you do it for them? Fire alarm. If you have a fire alarm, we've already talked about this. We've talked about the acronyms, RACE. We've talked about PASS. I need you to think about what happens if the fire alarm is pulled. What is some of my first things that I, as the nurse, need to do? Most likely, you're going to hear it on the overhead paging where the fire is, if there is one, and where it's located, but still, you need to be aware of what's going on and what do I need to do. Peer review, what to report. Peer review, if you are reviewing a peer of some sort, what things do I need to report? We do need to report sometimes the negative things, but you also need to report some of the good things that that person does. If they're all bad, okay, then we probably can't report anything per se that's good. But if you can think of something good to report on them, think of, because again, you would want somebody to say something good about you. UAP, student observation. What would you do if there's a student observing the UAP? Make sure that student's competent, or that UAP is competent in their task, whatever they are planning to do. Make sure they're competent and they know what they're doing. Peer review, again, there's another thing on this one's on documentation, what to report. If they are documenting that someone is documenting that they are giving their medication, but the patient is telling you, I did not get my pain medicine. There's a discrepancy there. Probably someone's going to have to look into that. You are probably going to have to report that staff member, and then let your supervisor or whomever take over and deal with it. Trauma prioritizing. We like to always think that bleeding is the number one thing that we need to worry about. You do need to worry about it. You do need to worry about if they come in with a gunshot wound. But you also need to remember your ABCs. If your patient can't breathe or is having trouble breathing, it don't matter if they're bleeding or not, they're going to die. And lots of times it's wanting to know, what are you going to do first? I'm not saying that you don't stop the bleeding, because you should stop the bleeding. But perhaps one of the other things is more important, and you can work on that. Change of shift priority. You're ending your shift, and what would be your priority for, when you're making your report, or you're telling them about the patients. I'm going to tell them about 55A because they just had surgery. They just came back to me 15 minutes ago, and that's probably a priority. That person's probably going to have to be checked first. Delegation of care. Again, that is something, we can delegate all we want, but is this person competent? Is this person able to handle it? Is it within their scope? A UAP, vesicant med. A UAP, what is a vesicant med? If you don't know, you need to look that up. And what would I expect the UAP to do with that person? If you have questions about any of these questions, you need to email me or send me a message on Blackboard. I've been trying to check on it and see. Delegation of a glucometer. Glucometer does what? Okay, so that means this person's diabetic. So when I think about that, what would things that I could delegate for this person? And what are things that I can't delegate? I need to do myself. I'm the nurse. SBAR communication. We've talked about SBAR before. How is SBAR used? How is SBAR important? It's very important. HIV education. That's talking about teaching and leadership for anyone. If I was going into the schools and I was teaching about HIV education, what would be some things I would need to bring out in my spiel? Aspirin, PRN for medication. What do I need to remember about aspirin? And what do I need to remember about a PRN medication? PRN medication doesn't mean it's given all the time. PRN medication means it's given as it's needed. Most of the time the patient needs to ask for it. Heart failure telemetry plan of care. This is one that you got to think about. If I have a person that's in heart failure and they're on telemetry, okay. Plan of care. What would be some things as the nurse that I could plan for this patient to help with their care, but it's nursing interventions, and what am I going to do about it? think about your nursing process. Think about what heart failure is. I'd want eyes and O's. I'd want daily weights. I'd want to monitor their diet, wouldn't you? Would they be on fluid restrictions? Possibly. There's a lot of things with that you need to look at, vital signs and all that. So think about those types of things. A client complaint. What do I do about a client complaint? If it's something I can take care of myself, then I probably would. I may still need to bring it to someone else's attention. If it is something that you cannot fix yourself, it's beyond your control, it's beyond what you do, then you would need to go to your chain of command and figure out what needed to be done. Sometimes there's nothing that can be done. But as long as the patient knows that we are listening and we're trying and we're going to do our very best to take care of them and make sure that things are done appropriately, then sometimes that's all they need. But not always. You still have the ones that complain about every little thing. Changing, it's talking about communication. If there's a change in a patient's orders, if there's a change in their medications, if there's a change in their dressing, there's a change in their status, those would all be things that we would need to communicate to the rest of the staff. That would not only just be the UAP, that would be if you're an RN, your LPN, it would need to be the respiratory therapy. It would need to be, if they are getting care from a specific area, like respiratory or OT, is there a change in their condition? Are they going to be able to do what they had been able to do before? If they're not, then yeah, those people need to know that the change has been noted, and we're going to document it and document who we told. Assignment, an RN to teach. Is that appropriate? Yes, RNs do need to teach. RNs need to teach and document that they taught. What kinds of things are they teaching? We're not going to teach about a surgical procedure that you're having done, per se. We may educate. But even with that, again, you got to remember, a lot of that falls to the doctor. But you can teach about finger sticks. We can teach about diet. We can teach about care of a diabetic ulcer when the patient goes home. So think about who we would assign to teach certain things. Nursing is nursing regardless. There are specialty areas, and those specialty area people are better at their specialty. But any nurse should be able to teach certain things, regardless where their specialty lies. But again, you're going to have to look at the questions. You're going to have to read through it and see. This is all for the review that I have. I've went over pretty much every question, maybe not as in depth as I would have if we were meeting face to face, but I've done a lot of it. And again, please do your questions. I think that's really going to help. I wanted to finish up the review though, because we have the management exam, HESI, in 2 weeks. And I wanted you to have the chance to listen to it, and then if you need to listen to it again and take notes. And again, also, if you guys have questions about anything, or you have questions about a question or something that I stated and you didn't understand what I meant, I may not understand either, because it doesn't give you, a lot to go on. But we're certainly going to give it our best shot, and I'll try to figure it out, and we'll try to work on it together and see what we can come up with. But again, you need to reach out to me, because I don't know if you need assistance or not. So that's all for this, and if you guys have any questions, you get back with me, and I'll post this here in just a little bit. Thanks. Bye.